Great. Okay, so this is the second rerun of this particular topic in this meeting. And I will give you a link to go and have a look at the last meeting. In the last meeting, I did a presentation and went through various things about coronavirus and long COVID, and I'm going to be covering quite a lot of that again. And then after that, we're going to chat to Suzy Bolt, and I'm hoping we're going to do a bit of a question and answer, or Suzy's going to talk to us about her experience of long COVID and also what she's been doing to work with people that have got that condition and how she's been teaching them. So we're going to have a chat with Suzy, followed by some time where we go into breakout groups, talking amongst our groups about our own experience either of coronavirus or long COVID, or if we've worked with people with long COVID, our experience of that, or if we've worked with people with fatigue conditions. So I think it's worth saying here that long COVID isn't the same as other fatigue conditions, but it strikes me, and maybe it strikes you as well, that there can be similarities of approaches in how we work with long COVID, and picking up information and techniques that we may use with other people that have fatigue conditions like chronic fatigue syndrome or ME or MS or other conditions or other similar conditions. So that's the breakout groups. Then we'll come back together. We didn't have time for this in the last session, but we're going to feed back through the session after that. And then to finish off, Penny will talk to us a little bit about yoga therapy in the UK and bringing together yoga therapists to form a professional association. Okay, so that's the agenda for today. Let me just if I put myself onto speaker view, oops, not sure why, Paul, I'm not sure why you've come up there. That didn't work too well. Let's go back onto gallery view. When I put myself onto speaker view, could you see me or somebody else? You could see me. Okay, oh, that's fine then. I had Paula O'Shaughnessy. Can you see me okay? Just give me a thumbs up. No. Some can and some can't.
Yeah, it's just still on gallery view. Nothing changed. I just didn't see anything different.
Okay. Well, I'll leave it as gallery view.
I wonder if we all need to change our own thing to speaker view, because I've just done that.
Yeah,
well, we can pin Barbara to our cameras if we want, onto our screens, if that's the most appropriate.
Yeah.
We can all just pin you.
Okay. Okay. So choose what view you would like. I'm going to talk for a little bit, and then we can kind of have a chat with Suzy. So I was having a chat with Carl this morning just as we joined the meeting, and I had some PowerPoint slides to show you. I don't have those because in between this morning doing a few changes and then now my PowerPoint has decided not to work anymore, which means instead of PowerPoint, you get me talking for a little bit. Okay. So let's think about coronavirus. Yeah, who knew really that the coronavirus existed before 2020? But it is what's called a SARS virus. That's a severe acute respiratory syndrome virus. And we have come across SARS viruses before, notably in 2002, 2003 in Hong Kong, there was an outbreak. Different virus, of course, we've got a different SARS virus now. And of course, we know now it transmits between humans. So when coronavirus started appearing, the initial thinking focused around the virus in its acute phase and how to deal with the numbers of people catching it and suffering the severe reactions requiring intensive care. And at that stage, March 2020, initially, about 1 in 5 people catching COVID-19 needed hospital treatment. And that, I don't have the exact data for that figure now, but I suspect it is different. And of course, with each variant that may come along, then that might be a different number again. Okay, so for those people going in intensive care, it's already thought that about half of those people leaving intensive care will have after effects and need ongoing treatment and rehabilitation. So if we think about the effects of COVID, they've been grouped together in kind of 4 main types of effects. So first is direct effects of viral infection and tissue damage. Okay, just for people making notes now, just to let you know, you can watch all of this on YouTube if you prefer not to write. Okay, so the first one, direct effects of viral infection and tissue damage, scarring, fibrosis, pneumonia, which can cause long-lasting damage if that occurs, sepsis if that occurs and needs treatment, and other conditions requiring recovery over months, or long-term care or permanent long-term care. And then a second effect is excessive inflammation and subsequent damage, and that can be inflammation, for example, of the heart muscle, and links to other inflammatory responses too. Third effect, post-viral autoimmunity. Viral infections are a major trigger of autoimmunity and associated conditions. And this is a really complex picture. So after you have a viral infection, it can lead on to other things, and that's perhaps becoming most apparent now. Also, our immune system, if we've had previous viral infections, our immune system may be slightly compromised.
Oh, yeah.
Okay, and fourth effect.
Can I call you back? Sorry. Yeah, in a couple of hours.
Just, Carl, if you could mute.
And I'll see, you know, if you're up or not.
If you could, I think it's Penny. So
Lovely to hear your voice. Bye.
No,
it was Sarah. Sorry. Just mute myself.
Sorry.
Yes, call them back. Okay, and then fourth effect, complications emerging from the formation of blood clots in various tissues and organs, which need sometimes critical attention. So those effects are primarily around coronavirus itself, COVID, and the kind of acute effects that come as part of COVID-19. So what wasn't known way back in March, April, May, it wasn't known that as the pandemic started that there were going to be these longer term effects of COVID-19 for those who had experienced coronavirus in a mild or moderate form, but then didn't recover as suggested. So, you know, the suggestion was 2 weeks and then, you know, then you're pretty much done, back to normal. We know now that that isn't necessarily the case. And by patients themselves, the name long COVID developed. Some in the States, I think it's called long haulers. So long COVID was the name given to this long-term effects of COVID-19 over weeks and into months as well. If we think about the numbers of people that seem to be affected by long COVID, I've got 2 little bits of data to share with you. One is from the Zoe Symptom Tracker app, which you can download on your phone. It's been put together by a medical company, and let me get this right. I think it's the, I have to double check, one of the London universities. Suzy might be able to tell me, but on the Zoe Symptom Tracker app, they reckon that the number of people experiencing long COVID may be about 1 in 50, which is quite low. I think that's based on the fact that they took the number of people that had a positive test and looked at the symptoms ongoing. Compare that with statistics from the Office of National Statistics, December 2020. they think maybe about 1 in 10 people will have symptoms over 12 weeks and more. So we've got, maybe we're looking at the range of 1 in 10 to 1 in 50. Who knows at the moment. Office for National Statistics is maybe, maybe that's the more recent one in December 2020. This is still an evolving situation, isn't it? People are realizing that they've got longer term symptoms. They're going to their GPs. They may have had a test. They may not have had a test. If they developed COVID early on in March, April, they probably didn't have a test. They may have a test later. And as Nikki told us in the last meeting, she has long COVID, went to have a test and didn't get a positive result. So then she was questioning whether she'd actually had what she had, but at the time, 2 GPs had told her, yes, she had coronavirus. So it's a really quite a difficult number to quantify. Anecdotally as well, there's people experiencing these symptoms that are going to their GP and not necessarily being pointed in the direction of that diagnosis. Okay, so what does long COVID look like? It's a really, really wide list of symptoms. I haven't got a list in front of me, so I'm not going to run through a list, but primary symptoms are fatigue and breathlessness. What else was I going to say on that? I haven't got it on the tip of my tongue. So let's stick with those 2. Have a look at the slides on YouTube if you want to get a more comprehensive list. But
can I just interrupt very quickly?
Sure.
Sorry, I'm in week 9 of recovery just now, so I'm still quite clear about what's wrong. But one of the biggest symptoms of long COVID is insomnia as well.
Okay, yeah, that's a useful point. I think Suzy's going to tell us about this. So it does link into the next bit that I'll tell you about, which is 4 or more known mechanisms for long COVID. Okay, so let's run through those, because one of those we'll pick up on the dysregulation of sleep-wake cycles. Thanks, Jennifer, for mentioning that. Okay, so 4 known mechanisms, there may be more, but first is post-intensive care syndrome. This applies to people that have been in intensive care, various dysfunctions after intensive care from the loss of strength following immobilization, and then psychological impacts as well. There can be, people may have been in coma states, they come round again, there may be cognitive impairment, there may be post-traumatic stress disorder, they may experience delirium or anxiety or depression or brain fog, and the list kind of goes on and on and on. So that makes sense, doesn't it? If you've been in intensive care, there's a loss of strength, but there's lots of psychological effects too. The second mechanism that I'll mention is post-viral fatigue syndrome. This was noted from the SARS outbreak in Hong Kong, and an indication that the virus had passed through the blood-brain barrier into the hypothalamus, which is part of the brain, via the olfactory nerve. And this could be a possible reason for the anosmia, the smell-taste interruption that people are reporting in COVID. And then the buildup of pro-inflammatory agents leading to autonomic dysfunction. So acute high fever, dysregulation of sleep-wake cycles. So as Gemma mentioned, that really disturbed sleep, waking up when you should be asleep in the early hours, or not just an occasional thing, but a pronounced pattern. Also, cognitive dysfunction, brain fog is a major symptom, and also profound and unremitting anergia, and that means extreme exhaustion, exertional exhaustion. So you carry out an activity and are exhausted afterwards. I don't think we can overemphasize that. I think it's very important for us to remember that there's a lot going on that may make people exhausted. So, and if you've worked with people with chronic fatigue syndrome or ME, you might have also come across this too. Okay, so that's the second mechanism, post-viral fatigue syndrome. Then the third, permanent organ damage. The lungs are susceptible, of course, because it's a respiratory syndrome, but also the heart muscle, damage to the heart muscle, damage to the brain, and that affects mood and fatigue. And the last mechanism I'll mention is post-COVID syndrome. If you go and have a look on the Zoe Tracker app, the symptom tracker app, it groups symptoms together in various groupings. So I haven't got that in front of me, so I'll just direct you to go and have a look at that, or have a look on the YouTube video that we put up on the last meeting. Okay, so quite a lot to take in there. Let's what I'll do is I'll put in the chat later on, I'll put in the chat the link to go and have a look at both of those YouTube videos, and you can have a look at Nikki talking about her experience of long COVID and what she did to self-manage her condition. And you'll be able to go and have a look at me presenting my slides on YouTube as well. But let's say hi to Suzy, and Suzy, if you unmute yourself and say hi and tell us your experience of catching coronavirus. We had a very brief chat yesterday, didn't we?
Yeah. Hi everyone. So I'm a yoga teacher, Iyengar teacher trained about 25 years ago, and I was just getting myself all set up online and raring to go just before we went into lockdown. We went into lockdown and I sat down on the bed and went, oh, I don't feel very well. But the range of symptoms for me was so extraordinarily strange that I knew straight away, whatever this is, this has got to be that thing that we're all hiding from. And of course, no one could get a test then. So my symptoms ranged from feeling like I had salmonella to extreme chills in my body, like someone had poured a kind of icy fluid in me. They were constant. I had a fever, I had a sore throat, I had a tremor. And that just kind of ran with me for quite a while, not to the point where I felt incredibly unwell, to the point where I couldn't get out of bed, but I definitely didn't feel good. I thought, oh God, something terrible is in me. And I was kind of busy trying to teach and sort of turn everything around, sort of work-wise, because I also work as a facilitator for academic leadership teams. So all of my work had suddenly disappeared. So I was just kind of busy. Managed to kind of scrape along for 6 weeks with those symptoms going on, and then fell off a cliff and became incredibly unwell. So, you know, one of the things that I was listening to you talking about there was actually the fatigue never really kicked in for me. What happened was a sort of a super adrenaline state, and so the sleep thing comes in there. So at no point could I sleep for more than an hour, despite my body desperately needing to. There's postural tachycardia syndrome that a lot of people with long COVID get. So look that one up, POTS. My lungs became involved, so I got extreme lung pain, so I couldn't sit up or stand up, but there was no inflammation markers when I went into A&E. Costochondritis, so you get extreme pain around the muscles in the lung sort of cavity area, but they can't really pinpoint it to anything. The GI symptoms continued for me for quite a long time, and one of the things that happens or happened for a lot of people around March, April, May was there was no help at all. And we were all kind of scrabbling around in the dark. And so a lot of people really found each other on Facebook, along with the doctors and consultants and nurses who all had the condition as well. And we were all kind of sharing information. So actually, that was the lifesaver, you know, because you'd call 111. There was times when my husband thought I was dying, and he'd call 111 because you weren't allowed to call 999. and they'd say, is she breathing? He was like, yeah, that's pretty much the only thing she's doing. And they were like, then she's fine, go away, we can't cope. And so you have to find somewhere else to get help, because that's an incredibly disempowering, quite scary place to be. You're at the illest you've ever been, and no one wants to look at you, no one wants to touch you, no one wants to even come and stand near your door and kind of call to you. So it's quite strange. So what I did when I started to finally get a bit better was realize, I wonder if some people would like to learn how to kind of calm themselves down a bit. And maybe we need to completely rethink how we're treating this, because actually if what they're saying is, you know, and I went into A&E and I had all my bloods done, no inflammation markers, no clots on my lungs, you're fit and healthy, they said, you're good, we can see you're doing the virus. You know, I was in the red side, they could see all of the symptoms, but there was nothing that they could do. They just sent me away after 12 hours and went, good luck. But we think you're going to be okay. And that was when I set up a Yoga for COVID Recovery Facebook group, which now has heading up to 3,000 people in it from 55 different countries around the world. And there are an amazing array of symptoms that people talk about and people share. And obviously there's other COVID Facebook groups and long haul groups, which have sort of over 30,000 people in. They're really interesting resources if you're interested in working with people. And, you know, I think the figure will be around 1 in 10 people that go on to have symptoms of COVID will go on to have a longer version. So March 26th was my start date, and we're here in January, and I still have lung pain, but most of the other stuff apart from the insomnia has pretty much gone now. But it's been a really, really interesting journey.
Yeah, I think it's worth saying that, you know, the symptoms can be, the long ongoing symptoms can be really severe, but they can also be, I suppose, annoying. I was listening to something on BBC podcast, and somebody was talking about their long ongoing symptoms as a loss of smell and taste, which, you know, is not quite the same as chest pain and fatigue or sleep dysregulation. So there's different levels of disturbance, I suppose, with those long ongoing symptoms too.
Oh, totally. So, you know, I'm in contact with people who are extremely unwell and physically disabled now, 9-10 months after their initial kind of viral exposure, who were marathon runners before. So for them, their lives have completely changed. You know, I think there's one guy in particular I'm thinking of. He was a teacher in a secondary school, and for him, he's set his goal of getting back to work perhaps next September. If he's lucky. You know, he has 2 young children. He can't walk them out around the park yet. It completely paralyzes him for 3 or 4 days if he does. So just the level at which it's affecting people differently has been the biggest and most sort of shocking thing for me. You know, I feel like, you know, my story, if I tell it to someone who hasn't heard anything, they go, oh, that's shocking. And I go, no, no, trust me, there's way more shocking out there. I know people who've now got MS because of lesions on their brain. They've had, you know, cardiac failure. People have had strokes, very fit and well people. So the range of damage that happens is astonishing. And for many people, you know, we can't really think about this as similar to chronic fatigue. I think there's elements that are, but actually there's damage. There's people that are damaged mentally as well as physically. Yeah. The trauma for some people, especially in those early days when no one would come and help, the trauma for some people, I think, will be, you know, really, really in need of psychological care. I myself got myself straight back into counselling in August. I trained as a counsellor. I was like, I need to debrief that experience for myself so that I'm not going to carry it with me, because, yeah, it was scary at times. And people are just kind of figuring that out. You know, a lot of people don't know anything about self-care particularly, or yoga, meditation, the benefits of counselling. And so, you know, at the moment, I feel like I'm the go-to place for people to go, I've been struggling for 6 or 7 months with this, and I found your group, and oh my God, this is what I've been looking for. And it's like, yeah, good, we're here, it's okay. You know, there are some things you can do Whereas most times people are turning up at their GPs and their GPs are going, there's not a lot I can do, but I can put you on antidepressants. That will help. It's like, well, okay, that possibly will help. But that's not the only thing that we can do, definitely.
So perhaps that sort of leads on into, you know, what's your experience now of teaching people with long COVID? Because when we talked yesterday, it was obvious that the classes needed to think about teaching yoga in a kind of really pared back, gentle, you know, allowing people to rest sort of way. So could you tell us something about what you've found as you've been doing those classes?
Yeah, definitely. It's been, obviously, as you would imagine, a sort of trial and error navigation, but the thing that I have really landed on as a system that works well and actually helps to recondition people as well as give them a mental grounding is to divide my classes into two. So now this is how I do it. I'm not saying you will need to go and work with someone else now, but I work with a personal trainer. Because one of the things that people try to do after being really unwell for a long time and having very little physical movement is they don't really understand how much muscle they've lost, because if you've never been that unwell, you don't really understand how much you're going to lose. So I work with my personal trainer, and he does these kind of 7 or 8 really all lying down incumbent exercises to help people start to rebuild some muscle tone. So we kind of separate that out, because none of the yoga practice really can be about building strength. It needs to be about allowing the autonomic nervous system to calm down. So focus on relaxation, guided meditations, easing out of the joints. And I just do a really gentle joint mobilization thing. People are lying down. Not everyone is comfortable lying down. Not everyone can move particularly well. So, you know, it's really, really slow practice, very much about the breath. Some people can't sit upright, particularly for very long. And it's, for me, the focus is on creating a space where it doesn't matter, just show up, because chances are you've been on your own, you're feeling a bit lost, this has been going on a long time, you're demoralized. Come and be with a group of people who know what you're going through and who get it. And it's the snakes and ladders, the recovery of long COVID. You can have a couple of weeks where you go, oh, actually, I think I'm good. And that even the language that we have in society around, have you turned a corner yet? That's gone. We're not allowed to use those words anymore, because long COVID is a circle. You know, you might feel good for a bit, but you know it's going to come back around again. And that will go on for months and months and months until slowly the circles get a bit smaller. So sometimes people just show up and lie on the couch and they're present to the class. And sometimes people are doing it. And what we've got now is a group of people. So I started live classes. I'd been posting content since June, but I started live classes in September. And some people are now working with tins of beans, weights, and resistance bands, doing some of the exercises. So we have different levels, level 1, level 2, level 3. If you've been coming for more than 6 weeks, you're allowed to graduate a level. And then I work on the yoga practice to help people understand that actually one of the most important things is to learn to self-soothe, so that all of the systems which are just in absolute kind of frantic chaos can calm down again, and the immune system can start to do its thing. So I focus on something that I just call deep rest. We're just going to do deep rest.
Great, thanks, Suzy. Well, are you open to answering any questions if people?
Oh, I'd love to. God, it's been my life for the past 10 months.
Let's have about up to 10 minutes of questions. I'm going to have to put some time limits on it, because after that, so here's a chance if you want to ask Suzy something, or if you want to ask me something, you know, if we can answer your question, I don't know, stick a hand up or stick a question in the box, and let's see if we can answer a few of those. Okay, so we've got Petra, thank you. And I'm just going to pull up the chat now.
Is that a question?
Penny, I will put a link into the Facebook page. Thank you, Suzy. This is fascinating. This is from Petra. Can we watch or attend your classes to learn more? What kinds of breathing techniques do you use?
You can certainly watch. So I run my classes through a platform now, through my website. So you can, it's just contact me after this and I can send you a couple of Zoom classes to give you an example of what we're doing. To attend, you have to have long COVID and understand. So I wouldn't want anyone to feel like there was an audience for the people who weren't feeling so good, but I'm sure you understand that. But I'm happy to share the material for sure. Yeah. Definitely. Breathing exercise wise, I think this is an interesting one. You have to be really careful with breathing exercises, in particular with people with long COVID, because actually sometimes for people just taking slow and deeper breaths in can cause massive tachycardia responses. And so particularly for people who've got postural tachycardia syndrome, where you can be in a deep rest position and your heart rate suddenly jumps to 140, 150, actually just getting people to think about slowing their breath down was the biggest and sort of most important thing. And I do a little bit of the interrupted breath, Viloma Pranayama, just to get people to think about trying to breathe back down into their abdomen. So for a lot of people who had respiratory issues, their breathing has become very shallow and they've kind of stopped breathing properly. So getting them to understand, oh, I do have to work to get my breath back down into my abdomen a bit and soften all of the breathing apparatus up. So that's quite helpful, but generally just encouraging people to lengthen their inhale, lengthen their exhale, really, really simple stuff, right? That does tend to help people begin to feel like they're less afraid to breathe a bit more deeply. And I think I cannot stress how much fear and terror people have gone through. Because although most of the people that end up long COVID haven't been the ones intubated and, you know, in a coma, it's a sort of a different set of people. So they've just got different experiences and they're often just simply not discussed. We don't come under the, you know, we don't come under the banner. At no point did I lose my sense of smell. At no point did I have shortness of breath, maybe for a couple of weeks, but my issues were elsewhere.
Yeah. So Carl's asked a question as well. Do you, Suzy, or anyone else have an Ayurvedic view of COVID, long COVID, that informs relevant yoga practice, asana or pranayama?
This is really interesting. I've had some people in India contacting me actually about this and talking to me and kind of we have some discussions in the group. What I will say, I don't know enough about it right now to be able to feel confident about sharing that information. But I would say if you Google it, you're going to start finding a lot of information because the research is happening. You know, it's been happening since March and April when all of this kicked off. So start looking around because people are definitely finding routes through using Ayurvedic systems. You know, obviously India is using a whole other system to treat this. And actually they were very, very keen on kind of promoting a homeopathic take on this right from the off, which has been quite effective for them. So, you know, although you never get the whole story from any country because they'll safeguard a lot of what doesn't work.
Yes, great. Well, maybe as we go into the breakout rooms, people might have their own thoughts that they can share into the groups too on that one. So Caroline has asked, well, she's making a comment back to you, Suzy. This is something that happened with one of my clients. I think she's referring to the fear of the fear and breathing. She's been practicing yoga for years and we've been working with breathing again. I was just like Suzy says, she's fearful to breathe, so we've been working with slow abdominal breathing.
Yeah.
Great, thanks, Caroline. And then Jaya says, can you explain the name you called the tachycardia when some settle into breathing, please?
Can we get that question just slightly reframed? I can talk about postural tachycardia syndrome if that's something that helps. So again, lots of information out there. It's quite a common post-viral condition where the body simply cannot regulate the heart. And at any moment, you could be asleep. You could be walking around. You could be sitting watching a movie. Your heart will simply go crazy, which then causes a massive energy drain. So imagine the energy it takes to get yourself up to 150 heart rate, right? You're jogging on pretty fast. And so then extreme exhaustion, where you have to simply lie down or stop what you're doing and, you know, get on your hands and knees. So it's a really scary condition for people, and one that there isn't a particularly magic cure for. And actually, there's a GP that I work with in my classes, and she has it quite badly. And, you know, for her, she's quite fascinated by this, because she's never encountered anything like this before. So, you know, I always like it when I can see someone who will now be able to go and help someone else from their own experience, which I think is a great point. So a GP to be going through this, like loads of doctors and consultants and nurses are, they know now what it feels like. I, as a yoga teacher, know what it feels like to not have the energy to lift my arms up, you know, unless you've had those sensations. When you ask someone to do something, there's an automatic sort of understanding that they're just going to be able to do it. And, you know, really, I can't stress enough the physical toll that this virus will take on people is huge. And so, you know, go right the way back down to base expectation. Let go of the idea of doing asana with people, you know, kind of break them down into tiny pieces and just start to loosen and get people to get back into good relationship with their body, because the amount of people that feel like they've just totally disconnected, they're afraid of their body. You know, I felt like for months, I would wake up every morning and there'd be a new thing happening with me, a new symptom had come. And it was like I was in a video game, like what's happened? So this new thing, oh, now I've got a tremor, now I've got a stammer in my speech and I can't talk properly. You know, where did this come from? A quarter of my hair fell out, you know, just whang, 2 weeks, all went. Just these things are sort of a constant surprise gift when you have long COVID. They know a lot more about it now. So, you know, they know that there is something called mast cell activation syndrome, which is to do with the production of histamine and the over sort of active nature of the immune system. So, you know, getting people onto high histamine doses and low histamine diets, high antihistamine doses, low histamine diets is now proving to be hugely effective. So if you are someone with COVID, start to look up Jez Mendinger's video, because they've been doing research since March, and there's now some pretty clear guidance on what to do to avoid this lasting for so long.
Yeah.
Sorry, I'm chatting away.
No, that's fine. That's fine. We've got a comment from Zoe who says, I've just realised that I have been suffering with this and it's been quite frightening. That's the Tachycardia Syndrome. Heart suddenly racing even when at rest. I think I had COVID last March.
Yeah.
So on the any other kind of last questions, because I'd like us to move into the breakout groups soon. But if anyone's typing anything, just carry on and finish your question. But just before we go into the breakout groups, I reminded myself that I wanted to tell you something which is related, but not exactly long COVID. And that's around recent change to the NICE guidance on chronic fatigue syndrome and ME. The guidance used to talk about graded exercise, and that's now being removed from the guidance.
Thank God.
It was fairly controversial for all sorts of patient groups, and it was controversial taking it out, but they've now removed that from the guidance for those conditions. And the other thing that was included in that was CBT. CBT was included as a treatment, and that's been reworded to say it can be a support, but isn't necessarily a treatment. So it's worth noting that those guidance have changed. The kind of forefront of treatment on low COVID, I think in the UK, is happening in the armed forces. I don't know if you've seen this, Suzy, but in the armed forces, they've got a specialist unit where armed forces personnel are going into a 2-week kind of retreat where they go and they have all of the tests, all of the assessments. They go and speak to psychologists. They have training on relaxation and meditation. They go through, the different questionnaires. They learn as much about self-management as one can in 2 weeks, and they're going to do a 3-month follow-up to see how armed forces personnel are going through that process. But one of the main things that they pulled up was the importance of rest early on, and really to deal with those cycles of feeling okay and then crashing. So reminding, if you're working with anyone that's got coronavirus, remind them to keep taking a lot of rest. Yeah, so let's see what we've got questions here. Sarah says, Suzy, what practices were critical to your own recovery? This is a question, by the way.
I think number one, acceptance. Acceptance that this was nothing like I'd ever had before, and I needed to treat it completely differently. So just to give you a snapshot of who I was before physically, I'd been teaching for years, practicing for years. I was also boxing to build up strength. And I'm 48, 49 this year, and I wanted to be strong. I wanted to get my muscles back. I wanted to have kind of energy. And so I was really fit and strong. And of course, you get really sick, and the first thing you want to do is go, great, I'm beginning to feel a bit better. I want to get strong again. And as soon as I do anything cardio, and obviously, you know, this is one of the links with CFS, anything cardio would trigger a relapse of every single symptom. So like food poisoning, the chills, the headaches, the tremor, the stammer, the whole shebang would come back. And it took me a while to go, oh, I think there's a link to what I'm doing and what's happening with my body. And actually, I have to let go of being fit. Actually, what I need to accept is I need to get myself well, because this virus has damaged me. And so for a lot of people, they find me when they've reached that point where they've been trying to exercise. They go, oh, you know, I started to feel a bit better, so I went for a run. And it's like, okay, how did that work for you? No, well, it put me in A&E. Yeah. And actually, so acceptance is key. So, you know, as part of my practice, that would be the biggest thing, just sitting and going, okay, I am going to think differently. I'm going to really, really love my body now, and not think about the gain of fitness or the physical kind of desire to look better in myself again. Just all of that had to go out the window. And then everything about my practice was slowly building a little tiny bit of strength. So I would do that separately. And that's why working with a personal trainer was really important, because we chose really specific exercises for people that had not been able to either get out of the house for months or, you know, get up off their chair very well or whatever. And then I did my yoga practice, which was just about taking out the physical stress tension. So a lot of just gentle supported opening poses. You know, I use my bolster for pretty much all of the classes. Cushions, pillows, just breathing and getting people to kind of ease through, because they're so tense and so stiff because they've not even walked, that actually you can't really think about it as a yoga practice in a traditional way. You know, all of that has to kind of go out. It's just about easing, you know, ease that body so that they are comfortable enough to do a deep relaxation. And that's what we focus on. Yeah. Every now and again, a little bit of focused work, maybe on the shoulders, or a little bit of focused work on the hips, but all supine and sort of easy to access. So yeah.
Brilliant. Thank you, Suzy. One very quick last question from Judy, because I know her. Hopefully this is a yes or no. Did use of sound also cause tachycardia?
Is this a question to me personally? Did it cause my own tachycardia?
I think so, yes.
Use of sound. Can I get it? Can you just unmute yourself and ask me that question again?
Yeah, sorry, I didn't quite phrase that quite right. It's I mean, the question is, did you use sound in your classes for yourself and for others? And if you did, was there a tachycardic response in some people?
So when you say sound, are you talking about just noises other than me speaking?
Yes, so either vowel sounds or chanting indeed.
I find, so the platform that I use to teach is Zoom, which I find is a bit of a nightmare for sound. It causes distortion and people end up getting it at slightly different times. So I'm teaching people in South Africa and Dublin and England and Belgium, and for us all to have exactly the same time frame with the sound, it's a big no-no. So I think I experimented once and went, okay, no, let go of that.
Okay.
People are like, that's a kind of catastrophe. So no, I don't use sound.
Okay. Is there anybody else on today's course? Have they worked with the chronic fatigue, fibromyalgia, that sort of group of patients or clients, should I say, where you've used sound successfully? Is there anybody here that can contribute?
Well, I can speak from my experience of teaching people with MS who have severe MS, and I think it's exhausting. The energy required to not speak so much as project your sound outwards. I use it a little bit for working with breath length, but we don't do very much because even pranayama is quite exhausting for them. So chant is like souped up pranayama, isn't it? And I've found my experiences it has to be used quite carefully.
Just thinking about the idea of chanting with the group makes me feel exhausted, actually. And I'm a lot fitter and weller now, but there's no way that I could ask them to do that. I think it would be tough.
So listening to sound could be different. And Jay has put a comment in the chat to say, I have been listening to a sound healing YouTube that soothes me. So listening is very different. Yeah.
Listening is definitely great. And, the majority of people that are in my group are on some kind of meditation app like Headspace or Calm, and they're all listening actively because, of course, they're not able to really do very much else. So they're hyper vigilant on social media and doing a lot of meditation apps, which is great. The first one, not so great.
Great, good. So let's move into the breakout room. So I'm going to stop my recording now.